My name is Jaquiro. I'm a medical doctor and I'm a health informatician as well. I'm a co-founder of the MyCPDZW application along with Mr. Yangama Jaquiro, who is a lecturer at the La Trobe University in Melbourne, Australia. This application is a product of the Vaka Health Foundation, and it came about some 3 years ago out of a very frank and open discussion where we were just discussing challenges that health workers in Africa face in terms of accessing health education, continuing health education to advance their careers, as well as clinical decision support tools, given the context of sometimes challenging resources that Africa faces. We were comparing, of course, with the developed world, and we thought, could we come up with an IT platform which could actually aid health workers in Africa bridge those challenges, access to health education as well as clinical decision support tools. This is how this application came about. With such a background, the journey that MyCPDZW has taken over the last 3 years from its launch in early 2019 is amazing. We have registered over 28,000 health workers on the platform to date, and these include doctors, nurses, paramedics, professions from various facets in Zimbabwe. And we have also gone into Uganda, where the application is also launching and recruiting people who are registering onto the platform. You will see that in Zimbabwe, health professionals are using this application. For example, doctors, when they are assisting patients, they will refer to the application to use the clinical decision support tools on the platform. And one of the popular ones is the drug condition guideline, which we call ADLIS in Zimbabwe. These two on the platform now provides a digitized version of this clinical reference guide, where doctors can actually be able to refer on the platform to check for drug interactions. You will see that nurses as well coming onto the platform, using this platform to make reference to the clinical tools section on the platform. And sometimes if they are managing an emergency, they will be able to refer and check appropriate management to aid whatever they are doing on the patient. And this has really been very helpful. We have received some positive feedback from some of the users of the application who bear testimony that the application is providing them information which is updated and current, so that it enables them to actually manage their patients better. So we are building some of these protocols on the platform, and this is one area which we continue to need support so that we are able to ensure that we cover all facets of the medical aspect, which is quite broad. And the issue that I referred to earlier on around some of the challenges of our work settings in Africa, where the resources are limited, and as such some of the management is tailor-made to the existing situations. So some of our super users who are using the platform, like Sister Runia Chitura, are also giving testimonies around what they've been able to do with the platform.
I am Sister Chitura from Yanga District Hospital. I started using MyCPDZW in late 2018. Since then, I have enjoyed many benefits from the use of this application. It contains basically 6 features, which are the CPD activities, the professional courses, ADLIS, protocols, clinical tools, news, jobs, and groups. From this application and from these features, let's say the CPD activities. I have benefited from the CPD activities. It helps me to do online courses. It helps me to learn from the comfort of my home. We used to walk long distances to attend meetings so as to gain points for renewal of practice and certificates. But with this feature, the CPD activity feature, I can now do the online courses, the CPD activities in the comfort of my home, and earn points for renewal of practice certificates. And also, I can also continue to improve myself in terms of the knowledge that I have in the management of conditions. The protocol feature is number 2 feature. It helps us on how to manage complications or emergencies. In the healthcare delivery system, we are faced with emergencies basically on a day-to-day life. And we need to make prompt action so as to make sure that we save life. With protocols, you won't go wrong in the management of emergencies. It helps you to save life promptly. Then the ADLIS feature. It contains drugs, knowledge on drugs and drug interactions, the doses. So you won't go wrong. You will prescribe the correct drug and the correct dose. Then you will be confident that you've managed a patient in the correct way. Then the clinical tools, it contains protocols on the management of common conditions that we are faced with in Zimbabwe and in some parts or areas of Zimbabwe. For example, the management of malaria, the management of tuberculosis, as well as HIV. So you don't need to cram, you just click on the button, then it helps you to manage HIV, malaria, and other common conditions. Then lastly, the feature on news, groups, and jobs. It helps to equip you with the current prevailing information in the healthcare delivery system by clicking on the news, jobs button. And also, you'll be able to get a job from this feature, from the adverts that are put on this application. Basically, this is it about MyCPDZW.
So our application is remained centered around addressing the needs of our users who are health workers in Africa, around access to education as well as clinical and support tools. And content development is really going to be key in terms of how we are going to take this project forward. We have engaged a model where some of our super users are actually coming forward to provide content which is quite relevant for their out of context, and one of our lead content providers, Dr. Alice Mulema, shares a testimony.
My name is Dr. Alice Mulema. I'm a general practitioner and I'm currently pursuing my master's degree in diabetes management. I work at Nyanga District Hospital, which is a first level referral hospital for rural health centers around Nyanga. I interact a lot with nurses as they consult to me and as they refer patients from their rural health centers to the district hospital. When my CPDZW was launched in 2019, I was excited. Having worked in a rural community for about 10 years, I knew the challenges that the nurses had in traveling to go and attend workshops on continuous medical education. I knew the challenges that they had to keep up to date with guidelines in management of patients. So when my CPD came in, it bridged the gap in medical education. I then approached the people or the team that was responsible for developing the content on the application. I shared with them my experiences. I shared with them the common conditions that we see, the common emergencies, and the information that we wanted on the application so that we improve on our education and our knowledge in clinical management. That is when I joined the team, and it is exciting producing these activities. My area of interest is in diabetes management. Going forward, I look forward to that time when we have more specialists joining in the platform to develop the content so that they share their experiences and they help in the education of our nurses so that we build a strong health system in our country. And I also look forward to partnerships with different universities in our region and abroad, so that we can have nurses and other medical practitioners enroll in professional courses on the platform, and we build a strong health system in our country.
So as we now go forward with the MyCPDZW application, and along with the broader vision of the Vaka Health Foundation, our aspiration is clear. We will remain centered around addressing and meeting the needs of our healthcare professionals in Africa. We are looking at a platform which is going to be able to provide the clinical and support tools, to provide opportunities for advancement, empowerment for our nurses, for our health workers within the African context, along with the resources relevant for them to execute their duties. Our vision is to bring all health workers together and engage, exchange, and be able to actually make Africa a better place in terms of utilizing African knowledge to address African challenges.
The first time I came across the Vaka story and discovered what Yankana and his brother and team had achieved, I was absolutely shocked. to reach out to 28,000 nurses and health workers who work on the front line, or I should say front lines in Zimbabwe, and deliver more than 300,000 accredited learning units, all within 2 years. It was just amazing. All complying with the needs of the continuous professional development program designed in partnership with the Zimbabwe Nurses Council. Well, how do you do that? They did it, and it was all within 2 years, and it's just growing every month. Now, to use the vast access to the mobile network coverages and phones, and well, the phones aren't that great. The mobile network coverages, some of it is down into 3 or sub 3G, but there's no point in actually waiting. The health outcomes are needed right now, so let's just get on with them. That's exactly what they've done. And importantly, in Vaka, there's a broader strategy behind Vaka, which comprises building a guild for the nurses and the health workers in Africa. And such a guild, it's got a strategic purpose, and that is to enhance the professional knowledge of their members, to enhance career opportunities, and to fund and support charitable and benevolent causes within their own countries. And of course, and to support the nurses and broader health workers throughout Africa. It's a fabulous piece of work, and I'm very, very glad, very, very happy to be part of it, to lend my time and to lend and to donate money into this cause. It's a terrific cause, and well done, Yangama, his brother, and all the workers and team in Zimbabwe.